This is Gene Jones. I'm with the Southern Waste Exchange, and with me today is Jeanie Jaramillo with Texas Tech University. And Jeannie's going to be giving us an overview of medicine take-back programs and DEA regulations as it relates to that. So, Jeanie, I'm going to turn it over to you. I'm going to go ahead and start the program here and share the screen, and hopefully I'll pass the screen over to you. You'll be able to drive the train from this point forward.
Okay, thank you very much for having me today. Like you said, I'm Jeanie Jaramillo-Stametz from Texas Tech Health Sciences Center, and I'm going to talk to you all today about the DEA regulations. Can you go to the next slide? It's not.
Yeah, Jeanie. Yeah, if you just tell me at this point, I'll advance the slides. Except just not letting me do it either. So maybe I better. There we go.
Okay. Perfect. I just wanted to start with a little bit about my background. I graduated with my Doctor of Pharmacy degree in 2001 and then completed a drug information residency, followed by beginning a position as the managing director of the Texas Panhandle Poison Center in 2003. At that time, I also started as an assistant professor at Texas Tech School of Pharmacy. And then in 2009, we started our medication cleanout program. To date, we've conducted 49 medication take-back events across the Texas Panhandle, and this coming Saturday, we will have our 50th event, which is why I'm not there with you in person. Next slide. So I've listed a few objectives here. I would like to just review the DEA rules regarding medication take-back, and then determine the requirements for law enforcement presence, discuss really briefly some surveys and any outcome measures that might pertain to your take-back programs, and just go through a strategy for gaining law enforcement assistance. Okay. We did a lot of research when we were trying to begin our take-back program, and we found that there are a lot of rules and regulations to consider, and those included the State Board of Pharmacy, law enforcement rules and regulations, environmental regulations, and then, surprisingly to me, the Department of Transportation. We did find, as is typical, federal versus state, whichever regulations are more strict are the ones that will apply. And in many cases, there are no rules or regulations specific to take-back programs. Although they've been being conducted for some time, many agencies still don't have regulations that are specific to these. So the DEA now has rules on take-back programs, and those are included in the Code of Federal Regulations, Part 1300, and that's what we're going to go over today. Just needed to state I'm not a representative of the DEA, and what I'm presenting today are my interpretations, not necessarily those of the DEA. So the rules related to medication take-back and disposal, again, are, they started in the Controlled Substances Act, which was originally drafted in the 70s, and at that time they did not realize that people would not complete a whole regimen of medication. So initially, they hadn't written anything in about medication disposal. They changed that in the fall of 2014 to add some disposal verbiage, and that's Part 1317 listed there below with disposal. So this is the DEA webpage. So I go to dea.gov and click on drug disposal, and this shows the different sections of the federal regulations. Next slide. So subpart A is for registrants, and registrants are pharmacies or reverse distributors, other companies that are actually registered with the DEA. Whereas subpart B is for disposal from ultimate users and other non-registrants. So as take-back program coordinators, we are considered non-registrants. All right, so who is eligible to collect controlled substances from non-registrants? This is the part of the regulation that was changed in 2014. Previously, it was against the law for anyone to have controlled substances in their possession unless those substances were prescribed to them or they were law enforcement. So obviously, this prohibited us from doing take-back programs and taking possession of those items. That regulation did change again in fall of 2014 so that we can accept those items. So currently it states that federal, state, tribal, or local law enforcement can accept these items when in the course of their official duties and pursuant to this regulation. How we fit into this is that we operate in conjunction with local law enforcement. So we cannot do take-back events on our own without law enforcement present and have them be legal as well. Although I'm not certain that this, what I have here in parentheses, is specifically in the regulation, we have been told that we cannot use security guards or security teams. They must be certified peace officers. So 1317.35, collection by law enforcement. Federal, state, tribal, local law enforcement may collect controlled substances from ultimate users using the following methods. So it specifically lists, in the regulation that take-back events can be included in this. And there are some specific regulations that we're going to go over. And I've got an excerpt taken from the regulation that law enforcement that conducts a take-back event should maintain any records of removal, storage, or destruction consistent with that agency's record-keeping requirements for illicit controlled substances. So they can come to our events and actually take control and custody. And generally what I will tell them is that we just need them to manage those and destroy them in accordance with their department's policies. With more on the regulation, any person can partner with law enforcement, and this is a direct quote from the regulation. Any person may partner with law enforcement to hold a collection take-back event in accordance with this section. What law enforcement has to do, they have to appoint a law enforcement officer that's going to oversee the event, and the language that they like to see and or hear is that that officer or officers shall maintain control and custody of the collected substances from the time they're collected from the ultimate user until secure transfer, storage, and destruction. Only those controlled substances listed in Schedules 2 through 5 may be collected. And what they're trying to say here is we don't want to advertise our events as a way to collect things like cocaine, marijuana, other illicit drugs. And lastly, only persons entitled to dispose of an ultimate user destinant's property may transfer such substances to law enforcement. So we get a lot of questions on this. Someone says, I'm going to bring my parents' medications to the event on Saturday. They're controlled. If I get pulled over, will I get arrested? Technically, they could, but we've not had it happen. And my belief is if they're pulled over and they're between their home and the take-back event, then hopefully law enforcement will be understanding that they are making an effort to take those items for disposal. So where do we find more details on this? The DEA regulations where I listed that page, they're very brief, which is nice. They're summarized nicely, so it's not a lot of reading. But there are some more details that are in the full document, and I've listed the website here. That document is a couple of 100 pages long. It's full of good information, but not a whole lot of it is actually pertinent to take-back programs. The document is in Q&A format, so it's easy to read, and it has many of the questions that were posed to the DEA along with their answers that were sent in as they were trying to revise the regulations. So another question we're frequently asked, because we do actually inventory items at our take-back events, is it legal? The DEA was very concerned when they rewrote the regulations that anyone who was inventorying products brought to the events would actually create a situation where diversion could be occurring. So basically there's concern that as we operate our events, we on the inside could be diverting medications. And I can certainly understand where they have concerns about that. We tried very hard to express to the DEA, though, that data is needed. It's necessary for us to be in trying to address this problem on the front end instead of on the disposal end. So we pushed very hard to get them to allow us to collect information. And this language is what they ended up putting into that. And that is that law enforcement may continue to conduct take-back events when a law enforcement officer maintains control and custody. And it's the ultimate user that's transferring substances. However, non-law enforcement personnel may assist the law enforcement officer, and the final rule does not prohibit healthcare professionals from voluntarily polling ultimate users about the substances they are discarding, or from assisting ultimate users to separate pharmaceutical controlled substances and inventorying those items. So an inventory is actually allowed as long as you have law enforcement approval and agreement to do that. Furthermore, nothing in the rule prohibits law enforcement from partnering with authorized collectors or other entities to inventory or sort substances that have been collected, provided that they remain under the control and custody of law enforcement. So this is the portion that actually allows us to inventory the controlled substances. The final rule does require that law enforcement maintain control and custody, again, and therefore if they opt to inventory or sort controlled substances, law enforcement must make sure that that situation is secure and that diversion is not occurring. So how do I approach law enforcement? We twice a year, we have events across 3 of our campuses at Texas Tech, here in Amarillo, Abilene, which is about 250 miles away, and then Lubbock as well. So we have dealt with multiple law enforcement agencies, some that are much more willing to participate, some that we've had a little bit more difficult time. So my suggestions for approaching law enforcement are to have a clear plan before you make contact with them. The last thing you want to do is sound like you don't know what you're doing. Often you'll find that you will know more about the regulations than the law enforcement agency or person that you're speaking to does. They are typically not really, don't have a clear idea of what's going to be done at a take-back event and what can legally be done. So if you have those regulations to provide to them, that's also helpful. Be prepared to ask for what you need. So with the next bullet I've got, we need 1 certified peace officer to provide oversight, maintain control and custody of the substances. And I have here also a question mark by additional officers. We generally request at least 2 officers at our events. We like for 1 to be present out at the drive-through, preferably with a patrol car in uniform, just to be a visual that we do have law enforcement there. And then 1 that stays inside where we're processing the medications and doing our inventory, and that person's maintaining control and custody. Now, many of you may be doing take-back programs where you're not doing an inventory, and that's okay too. If you don't have the personnel to conduct an inventory, that's perfectly understandable. In that case, you would likely only need the 1 officer outside where you are collecting the medications. Also, we like to make clear to our law enforcement what our expectations are of them. So many of our events are not held on DEA take-back days. So in that case, we need to be sure that they are going to remove the items at the end of the day, that they know they're going to have to take those items back to their law enforcement department and secure those until they can be disposed of. The next bullet I have here is everything versus just controlled substances. We have actually had good luck in securing law enforcement by assuring them that we're only going to be providing them with the controlled substances that are collected. Overall, about 5% of what we collect are controlled substances. So that makes them feel a little bit better that we're not going to give them 1,000 pounds of medications, that they may go back to their department with 60 or 80 pounds. Also, if you are doing the event in conjunction with the DEA day, at least in Texas, we found that Often the DEA is unable to pick up the meds at the conclusion of your event. They just don't have enough agents, and we have such a vast area to cover. So they will frequently ask that law enforcement secure those items until Monday or Tuesday when they can pick those up. So these are things you want to make clear to them when you talk to them, make sure they understand so that you don't end up in a bad situation. Can we conduct curbside surveys? Yes, you can, and we actually have always conducted surveys. So I'm going to go through that really quickly. The rule does not prohibit healthcare professionals from polling ultimate users about the substances they are discarding. I will tell you it's very difficult to go through a collection of items from someone's home and ask them why they are discarding of each item. Sometimes they'll have 30 or 40 medications in a bag. Sometimes they're very old, and it's likely that they don't know why they're being discarded. They don't remember. So while you can ask some general questions, trying to get very specific information can be difficult. Guidance from individual DEA representatives varies. In some state that information should not be collected, but according to the rule, that is not prohibited. So our DEA agent will send us information for each event and will tell us, actually her directions say that we cannot collect information or should not collect information. But they are aware that we are conducting a survey, and they have not expressed a concern with that. I think overall their idea is to make sure that the public knows that the information is anonymous. They don't want people to not come because they think we're going to collect their names and things that might be questionable. So why would you do a survey and why collect data? Particularly for programs who don't have the ability to sort controls and non-controls or to inventory items. If it's just you and a couple of other volunteers, you may not be able to collect an inventory. These events can be massive in terms of what's collected. In this case, surveys are often the only piece of information that you can collect. And many programs need outcome measures to report to their funding agencies or to promote continuation of the events. It's nice if you can get the weight that's collected. So if you can weigh the boxes and record that information, that's a good outcome measure, along with the number of people who participated. And then survey data is very nice. And then the inventory information, if you're able to get that. At least with our program, we have access to all of our pharmacy students. So in Amarillo, that's about 140 students who often need volunteer hours. That's how we complete our inventory, or how we have the ability to do that. And we're trying to collect data on what medications are remaining unused in the home, so that we can then publish that information and work towards resolving that. We want to fix the problem at the front end instead of relying on our disposal. This is a picture at one of our Amarillo events. We have a nice long drive that has a U at the end so the cars can turn and go out the other side. And this is an example of one of our officers who just provides a presence. As coordinators of these programs, I think it's important that we acknowledge that we are at risk. Someone could decide to come and try and steal drugs at these events. So it's important to make sure the public knows law enforcement is there, and also that our volunteers and ourselves are safe. This is an example of the survey that we are currently using. So I wanted to just show you what our questions were. And we have tailored some of these to our needs. Our program, we actually do accept sharps. So we have a question about sharps just to help us be aware if there are sharps involved. We collect the postal zip code and then how many times participants have participated in the event. Initially, we thought people would come once and their med cabinets would be clean. They come over and over. We do collect number 4 about mail order service. So we're trying to determine what proportion of our participants do receive medications from mail order. And then number 5, we do ask people, what is the one main reason for disposing of medications? That's always the question people want to know is, okay, why are people bringing the medications to you? So we do try and get a general idea of that. Number 6, we ask them why they feel it's important to participate in the events, prevent abuse, protect the environment, and prevent poisonings. This helps us to market our events better. And a majority of our participants say they participate because they feel like it's important to protect the environment, which is interesting. But we always try and put that in our advertisements. You know, protect the environment, bring your medications for proper disposal. Then we ask them what they would have done with the medications if they hadn't been able to come to our event. And we actually see probably about 65% of our participants say they would have kept them. That's a really good piece of information to have to show that, you know, if we weren't having these events, these items would continue to sit in medicine cabinets and be a source for poisonings, for abuse, and other activities. And the last one is just regarding our poison center. We do receive some funding through our poison prevention grant, so we ask this question for that purpose. And that's the basic information that I have. Medication take back is my passion, so I could probably talk for hours and hours on it. But if you have any questions, then please feel free to shoot me an email or call me directly. I'd be happy to help in any way I can.
Jeanie, thank you very much. I got a couple of quick questions for you. I'm going to cover in the next presentation a little bit about how we market our event. But just from, I guess, comparison purposes, how do you all market your events, and what have you found out to be the most effective marketing communication out there for the effectiveness of your events?
Okay. We did actually used to ask a survey question, which was, how did you hear about the event? And what we found is the one piece of advertising that we do that's most effective is a front page newspaper sticky ad. So our local newspapers will place a little, I think it's 3x4 sticker on the front page of the newspaper, and it's just a small advertisement for the event that we typically do the day before or the morning of the event. Many of the participants are elderly, and they do tend to still receive a hard copy newspaper. Aside from that, we do print out tear pads, which are usually about 6x4. They have 25 sheets per pad, and they say, bring your medications, you know, on this day to this location for proper disposal. We distribute those to all of our pharmacies. So they hand a sheet with each bag that they are dispensing medication with for about 2 weeks before our events. They also get a flyer from us. Those are our primary mechanisms aside from Facebook. Just because we're limited by budget. If we had more funds, we would likely use billboards.
Yeah, understand. Same situation for us on our events. Well, fantastic. Great presentation. I'm delighted that you were able to do that for us, and thank you very much.
You're welcome.